Well, thank you for inviting me this evening and giving me the opportunity to speak to you about a different aspect and how we approach facial cancer. The two prior talks by Dr. Dial and Dr. Diab are probably the most important aspect, detecting the cancer, removing the cancer. My job is to try to patch it up if required. What we're trying to do is minimize scars when we do surgery. But any type of scar, any type of injury, no matter from surgery or accidents, can cause scarring. And as you know, in the public arena, there are true scars and mock scars. And you may recognize some of these individuals. So I want to discuss with you, why do some wounds heal with an excess amount of scar? And what are the best current ways to treat them? All skin, no matter where you have an injury, will heal with a scar. The only organ in our body that does not scar is actually bone. So we always determine when someone comes in with a defect on the skin, how deep is it? Is it just this layer? Is it this layer, this layer? Like when you skin your knee from, let's say, after riding a bike, or even a cut or laceration, you want to keep it moist. And you'll find that by putting moisture on that area, it will heal twice as fast. So these are just examples of people with scarring of the upper eyelid, and basically ways that one can do to help the patient not only look better, but function better in eyelid closure. And she had a skin graft in that area. And last, what I'd like to say is this is an example of like a cancer defect on the scalp. Well, there's a concept called tissue expanders, where you put a balloon underneath the scalp. Okay, that's the defect with the skin graft. And she wants hair in that area on her scalp. Well, you put the balloons underneath the scalp, and you expand the balloon over about a 6 to 8 week period. And they got to be patient with their body, because they have a balloon underneath their scalp. It expands the scalp, and then you have enough tissue now to take out the balloon after 6 to 8 weeks and close the defect, called tissue expansion. And now she has a normal hairline. But one last one I want to talk about is commercial products. As you know, when you go to the store, there are many products out there that claim that it reduces scarring. And I would say the word is still out if there's anything that's better than the other thing. The key is, number one, keep it from being infected, prevent it from being infected, keep it moist, keep it protected, okay? You want to prevent, and once it heals after about a month, then you want to put sunscreen on it, strength 30 or 50 above, and that will decrease the pigmentation of the scar.